Just before I begin, I would like to just address a comment I made at the previous IGB. It was regarding pension credits and your eligibility. Now, obviously, there is a threshold there, and I never stipulated that, I never made that clear, that not every pensioner will be entitled to pension credit. It obviously depends on your financial situation. So I would just like to have that corrected, okay? I should have been more specific at the time. Okay, so now just going down to items of business. Do we have any apologies intimated, Justine? Sorry,
Yes,
Mark.
we have apologies, an apology from Karen Turner, and I understand Paul Ryan's attending as her proxy, and that's it, Chair.
Okay. Do we have any declarations of interest or transparency statements? No. Okay. Now, you'll appreciate, obviously, the weather conditions today, so there might be some technical issues. The officers are all well briefed. They've all trying to take over each other's briefing in case anybody drops out. But I'll just ask you to try and be succinct, and let's just try and get through this as best as we can. Okay, so item 1 is the minutes of the previous meeting. Do we have any comments or correction with regards to the minutes? Oh, we'll take that as correct then. Minutes are agreed. Okay, item 2 is a membership update, page 15-16. So this will be to ratify Councillor Cameron officially onto the International Joint Board, replacing Councillor Aileen Nicholson, Fiona. And it will also be to ask for a nomination to sit in the Integrational Joint Board, the Audit Risk Scrutiny Board. Councillor Hughes, Lisa.
Thanks, Convener. I'd like to nominate Councillor Cameron, and I understand that you'll be my seconder. So.
Okay. I'm happy to second that. That's fine. Are you happy to accept, Councillor Cameron? Oh, Jacqueline may be having troubles with her internet.
So we take silence as accepted?
Yes, we'll take that as accepted. Okay. Item 3 is the Chief Officer's report. Let's hand over to yourself, Christine.
It is, and I would just like to update on today in terms of our operational work. So just to give assurance to the IGIB that all our essential services are being delivered today. We're focusing on our most vulnerable. So right across the services in HSCP, we do have staff in and out and about seeing our most vulnerable. So I just wanted to take this opportunity to thank those staff who are making sure that we continue to deliver the services that we must deliver today in this exceptionally bad weather day. So it was just to update on that. Okay, so I then wanted to just move to the actual Chief Officer's report. Before I do that, there is, since the time of writing, there has been a ministerial statement on the future of the National Care Service, and that came out yesterday. So there has been some changes. I think we all kind of have been anticipating this. So the kind of key messages are deciding to deliver the National Care Service without legislating for structural reform and removing part 1 of the bill and continuing with part 2 and 3. So some of that is around Anne's law, and people will remember that's about the rights of residents of care homes, and that came about as part of, as a response to restricted visiting and things in the pandemic. So the bill will enable information sharing across health and social care. Breaks for unpaid carers will continue in the rollout of the carer support payments. There will be a National Care Service Advisory Board, and that will be established on a non-statutory basis. And the first meeting is expected to be in March. And the advice is they're looking for an independent chair with lived experience. What the Scottish Government will be reviewing health and social care standards, and IGIBs will continue as is, but SG will be considering what changes can be made to secondary legislation. So that just came out yesterday afternoon. So just to update members on that. Just moving back, sorry.
We're just thanking you for that update.
All right, thank you. So just moving back to our agenda, delayed discharge at point 5. We are currently third across Scotland. That's a wee bit of movement for us, but there's not much in it in terms of performance. But overall, we continue to be have the lowest level of standard delays across Scotland for the financial year to date. In terms of hospital at home, item 6, just a wee update, which is quite exciting, is we had our first patient discharged this week into our hospital at home service. So we had said that we would try and do this late December or January. So that's us started, and it will be slow and steady, you know, in terms of how we proceed with this. But that's our first patient has been received into that service. Item 7, our community link worker contract update. So that's been out to tender, and we are with you. We're awarded the contract. And just to draw your attention to item 9 around permanent recruitment of the Director of Primary Care. As you know, Renfrewshire host primary care support services, and we were recruiting for the permanent post, and we appointed Fraser McJanets, who will take up post on the 17th of March. So delighted to welcome Fraser. Yeah. And item 10, just to draw your attention to the Scottish Government Carer Census update. Yeah. And also item 11 around, if you've got a bit of time, a particular good read around the Audit Scotland publication, and that's about finance and performance of NHS in Scotland. I think that's all for that, apart from the last thing to just update is, as you know, I'm leaving Renfrewshire, and my last day will be the 28th of February. The recruitment for the interim chief officer is currently underway, and I'm hoping that there will be a handover period before I go. And just to thank the IGIB for all of the support that you've given me over the last few years. And I really wish you well going forward.
Well, Christine, you're a loss to us, you really are. Myself personally, you know, I take a lot of guidance and support from you, so I'll miss you. I see Lisa Marie and Jacqueline have both got their hands up.
Yeah, so firstly, I would echo what you said, Jennifer. I think, Christine, we're doing this report and you probably don't want lots of blethers, but you came in at a time when we were having quite significant issues with some of the things we were doing and turned things around, and I think that should be noted. We noted at the time, but I think it should be noted. And you've done a power of work on moving things forward, so I hope you take that experience to Edinburgh with you and can use it. I just have a couple of questions, or just small ones, and I suppose there may be a bit operational, but I think it's good to know. So firstly, I think the hospital at home model and the fact that we've now got a patient taking part in that is really exciting. I wondered if we were going to do case studies for our first 2 of 3 so that we understand how it goes and maybe pick them up a bit later as we develop the service. I think, you know, I love a case study and think they show how things really work for people, so I wondered if we were going to do that. And then with the community link worker contract, really good to see that we've tendered and got and we have someone in place. I wondered if that's the same person or if there's a bit of a handover period, or if there's going to be any great, because I think that's a really essential service.
So the first part of hospital at home, and thanks for your comments, Lisa Marie. So the first part of hospital at home is we had intended to potentially bring, and I haven't talked to the chair about this yet, bring some of that learning and some of the kind of case studies to a development session to talk through about how we would shape that up, and then I think we can make a decision about what you would like to bring to the IGIB. But it is exciting. No one wants to be in hospital, and if you can be looked after at home, I think that's a great step forward for us in Renfrewshire. The second thing, I'll maybe get Stuart to come in around our community link workers, if that's okay.
Yeah, absolutely, Christine. Yes, so the current provider, We Are With You, were also the successful bidder. We did have a good competitive bidding process and supported through procurement through GGC. But you know, it was definitely We Are With You who identified as the highest scoring bidder, and they've been notified, as have other bidders. So there shouldn't be any disruption to service. We had obviously built in time for potential transfer between providers and 2P, etc. But that won't be necessary because the same provider. And you know, just to note, we have slightly increased the investment in the link worker service in cash terms, really just to mitigate some of the inflationary costs. It's one of the few areas we have kind of increased the value of that contract, but I think we felt because it was so important and provided an awful lot of release of kind of, I guess, you know, more challenged clinical time, that was worthwhile. So that will continue in every practice going forward. Yeah,
that's really helpful and great. We have to have competitive processes, but I think not having a break is also incredibly helpful.
Okay, thanks for that. Jacqueline, welcome back.
Thank you very much. Sorry, I had some IT issues there. I joined by phone and then I managed to get back on again. Yeah, I just wanted to say well done in the delayed discharge performance, Christine, to you and the team. It's just something that I'm really proud of. I know we all are. And, you know, we see it time and time again that Renfrewshire's top of the charts. And I'm pretty sure that's part of the reason Edinburgh snapped you up. Only one small part of the reason, but yeah, so
it's a big part of the reason.
I imagine that would be. So I'll be watching Edinburgh's stats with great interest. I'm sure we all will. And I'm sure we're going to talk more about to say goodbye to you at the end, Christine. So I'll not get into that just now. I just wanted to say I was pleased about the announcement about National Care Service yesterday, and I'm looking at section 12 about the Christie Commission recommendations. About public reform, and really the National Care Service was really quite at odds with that, about local solutions and you know, things that we can do in terms of prevention and early intervention. So yeah, I thought that was really positive news. So that was all. Thank you.
Thank you for that, Jacqueline. And Ian.
Thanks very much. I too welcomed yesterday's decision. I haven't had the full details of it yet because I wasn't in the country yesterday afternoon, but I'll get the full details about the national care. But I'm glad to see the Scottish Government have eventually caught up with Renfrewshire Council, because we had cross-party support that we didn't want this. So I'm glad to see that's happened. Again, I mention this every meeting about the delayed discharge. Oh, well done. It's great. We're really at the top, and we have been for quite a while. So again, well done to all the staff. And like Councillor Lisa Marie Hughes, I would like to see a live case example of the hospital at home thing. I think that would, I can understand it, you know, I get it, but I think if we get real life examples, it would bring it a wee bit more to life. And just finally, I think we'd be remiss not to mention the wee carers, but some of the figures here are quite frightening when you get nearly 700,000 unpaid carers. 3/4 of them are female, and of course almost 1 in 5 are under 18, and it just shows you the job that carers do and the number of people involved. Both myself, Jacqueline and Jennifer were at a meeting last week at the Carer Centre, and I don't know if this woman her tongue was in her cheek, but she did say she would love to have the guts to take the person that she cares for up to the RAH and leave them and see what the reaction would be. And I think the whole NHS would collapse if it wasn't for carers. As I say, I think she was just making a point rather than saying she is going to go up to this afternoon with her loved one. But I took her point, and I think it just shows you how much we depend on carers, not only in Renfrewshire, but the whole of Scotland. Thank you.
Okay. If my recollection is correct, Ian, it was you that suggested that movement, but we'll move on. Right, so thanks. Any more questions or comments? No. All righty. Well, that moves us on to item 3, which is the Chief Officer's Finance Report, please.
Okay, so I'll keep this brief. My Wi-Fi is very difficult right in the heart of Ayrshire here. I think we're just about having a twister, so there's a few of us who will be impacted on it. So there are a couple of things to ask the IGB for approval in section 2 of the report, and it relates to the care at home regrade, which we have discussed in a number of meetings, but it's just to formally ask the IJB to approve the drawdown from earmark reserves to fund this. But I would also like to mention there is a typo in the recommendation, and instead of saying section 10.2, it should say 9.2, and the figure is 1.989, which reflects the figure in paragraph 9.2. So the overall position has improved since the last report, and this is basically due to all of the action that's been taken by the SMT, which has been taken over the past few months to try and do whatever we can to slow spend down. And you'll be familiar with the type of things that includes, because we've talked about it at previous IJBs, but these things do take time to actually bear fruit, and we're starting to see the impact of the slight slow in spend going forward, and we hope that that will continue into the final quarter of the financial year, because we need to do every single thing we can to slow the spend down so that we have enough reserves to help us in 25-26 to deliver that balanced budget, because the gap in 25-26 is so large and it grows again in 26-27. So we are doing, as a management team, we're working really closely to try and deliver whatever we can to slow that spend down. Obviously that does have implications. We're holding vacancies where we feel that's appropriate, but actually the vacancy process itself does take time anyway. So I'll end there and happy to take any questions.
Okay, that's great, Sarah. Thank you very much. I see there's a few hands up here. Ian?
Well, thanks again for your work on this, Sarah, and sharing your team. It's difficult times for everybody. I don't imagine you ever dreamt you'd be dealing with some of the situations here, but here we are. I've got two questions. Did any of the recent budget announcements by the Scottish Government make any great difference to our overall financial picture here in Renfrewshire? And can you tell me if any discussions are taking place with the Renfrewshire Council about any extra funding coming from them to help with services? Thanks.
Yeah, that didn't make any change to our assumptions. We still don't know yet what funding we'll be getting for national insurance. So when I prepare the budget report, which will come in March, it won't possibly be clear yet whether or not we'll be getting any funding, both for our own national insurance costs and whether we get anything for providers. So at the moment, the answer is no, we haven't got any additional information or funding. I have spoken to the Director of Finance in the Council, but as yet there is no additional funding coming forward from the Council, who you'll understand are in the same position as ourselves. So, but yes, those conversations have been had.
Thank you.
Okay, Jacqueline?
Yeah, similar to Ian, I just wanted to thank Sarah and the team for the work that you're doing, because obviously it's difficult times for all IJBs, so thank you for that. And also just wanted to say thanks for the work that's being done in prescribing. I think there's some really positive things happening there. But just as usual, I want to express my frustration that you know that there's a monopoly there where the companies just seem to be able to put whatever price they want on prescribing, and that's a frustration, I'm sure, for everyone. But I think it's obvious that the board and the IJB and GPs are doing the best that they can under the circumstances. So thank you for that.
Thank you, Jacqueline. And Mags?
Right, thanks, Chair. It was just to expand on that piece around prescribing, actually, because at the end of that section, it talks about projections indicate we're below expectations. So I'm just wondering what action can be taken there and what action has been taken to get us back on track to our expectation, albeit we do understand the point that Jacqueline's making that some of it is out with the board's control, but we have, as a board across partnerships and the health board, identified a number of actions. So it's just to try and understand how those have been taken forward.
Okay, I'll probably need to bring Stuart in as well here, but we've got a local action plan and the board-wide initiatives. So the pharmacy team working with GP practices are doing whatever they can to make the changes, the potential changes that they can make, but there will be some patients who can't be moved on to the different drugs for various different reasons, and Stuart will be able to explain those. But on the back of that, as well as the targets that we had for specific drugs, the prices have fluctuated for those drugs we were targeted. So the initial savings that we thought we would make from them won't be able to be realised because the price has gone up. So that's having an impact as well. And basically, if something's going on short supply, that's changing things as well. So whilst we are working away on the board-wide initiatives and our local plan, at the back of that, there's always something that's pushing against us, which doesn't help the position. And I think it's quite important to note that some of the new drugs that have been in the public in various different I suppose media recently to do with the weight loss management, they're starting to come through those costs, and there isn't a clear pathway yet for them, but they are very, very expensive, and they're being used for cardiovascular and diabetes, etc. So Stuart can maybe explain a little bit more about that. So whilst on the one hand we're doing what we can, there's all these new drugs coming in at the side, but we've got further discussions and plans for 25, 26. But again, we are at the behest of the suppliers and the costs that drive various different changes for us to manage throughout the year. But rest assured, there is a huge amount of work ongoing with the pharmacy team, with clinicians, lead pharmacists, accountants. Everybody is doing whatever they can to try and minimise the spend where possible.
Thanks.
Don't know if Stuart wants to maybe come in as well.
Yeah, not a lot to add really, Sarah. I suppose in context, I don't think we're an outlier though in terms of the achievement of the targets across all other HSCPs. I think it's been a consistent challenge across the board. So we're not an outlier in terms of the challenges we've had trying to meet the original targets. I think in terms of kind of board-wide work, which much of this is and has to be, we're meeting with the Director of Finance in 2 weeks, who's hosting all of the HSCPs, I believe, CDs and pharmacists and finance colleagues, to talk about this in the same way as there was a meeting with the Chief Exec, I think, just at the back end of 2024. I think ultimately much of this is not as straightforward as you might think, and I think as Sarah's described, we need really clear messaging to the public. We need understanding of the public to accept the fact that we're changing their medication, which obviously nobody likes change, but I think there has to be an understanding that the NHS is not in a position to be kind of always offering people a choice. Ultimately, if there is a drug that is an alternative that is better value for the NHS, but is equally as clinically effective, that I think people have to accept that. Now that's quite a challenging message, I think, and we've talked about that previously. So I think the thing that perhaps could be supporting all the HSCPs is ongoing additional work with comms at the board centrally and perhaps nationally, just being really clear about the scale of the challenges in prescribing budgets across Scotland and the UK, and the fact we need to bring the public with us and we need their support when we're making those decisions with them and trying to have conversations about making those changes. But I think ultimately I feel confident that what can be done is being done, and that the time that can safely be diverted to doing this work, as opposed to more urgent, unscheduled work, it is being done. I think we have to understand that this does take a lot of time away from GPs, practice nurses, pharmacists, and the time that they are spending doing this efficiency saving work and having clinical conversations with patients, where they are things like the anticoagulants, where you do need to actually have a clinical assessment and a conversation with the patient, rather than a switch from, for example, an inhaler where you've got exactly the same drug but just a different device or a different brand. That takes time, and that is time therefore that's not available for face-to-face clinical contact for people who've got unscheduled care needs or chronic disease management that needs to take place. So it's always going to be a bit of a balance, and we could on one end of the spectrum, we could stop doing a whole swathe of things and just purely focus on prescribing efficiencies, but ultimately you can't switch off a whole raft of the work that you're doing, because ultimately patients need and expect that. So I suppose this long-winded way of saying I'm confident the work is progressing. I'm confident that people are doing everything they can. We continue to prioritise this over kind of non-urgent other kind of pharmacy activities, and I think we work with the board to get clear messaging and try and continue to build the support of our our kind of members of the public. I've certainly shared with GPs when they've had some anxieties around this, the support we've had from our elected members on this meeting, which I think has been really helpful. So I'm grateful to colleagues who are here in an elected member capacity, because I think knowing that we've got colleagues on board with this, it just helps in terms of getting that message out into the public and to kind of to constituents. So yeah, we continue to do everything we can. As I say, I don't think we're an outlier.
Thank you, Stuart. It's always reassuring to get your take on things. Mags?
I was just saying thank you.
Okay, if there's no more questions or comments, can we agree the recommendations on page 25? Obviously, you know, with the typo that Sarah had mentioned at the start. So we're in agreement with that. Right, and that moves us on to item 5, which is Sustainable Futures, and that'll be yourself, Frances.
Thanks, Jennifer. Yeah, this paper follows on from the recommendations that the IGB agreed at its December meeting in relation to the Sustainable Futures programme. So following that meeting, the senior management team have considered the next steps and how we take account of the scale and breadth of savings activity that's going to be required alongside working in an exceptionally sort of challenging operating environment. And also importantly is the IGB and HSCP's desire to sustain our current strong performance across our services as far as possible. So section 3.4, I won't go through the detail, but that does highlight some of the key risks and challenges which have been considered as part of our planning, but could also impact the delivery of the savings and the related activity going forward. And I think it's all sort of areas that members will be aware of from previous discussions and updates. So it's therefore recommended that based on this, that the sustainable future activity is phased over the coming months, and we think this will allow us to more effectively deliver the agreed savings alongside balancing the required sort of demand and capacity pressures across the wider system. So this approach would also support the next stage of engagement of activity that's to be undertaken, and we've been discussing this with HIS and considering how we can best align with the principles set out with planning with people. And also, I suppose, just to assure members that the phasing that's proposed in this paper has been aligned with our financial planning assumptions, so it's been done in conjunction with the Chief Finance Officer. So based on those different considerations, section 4.6 of the report sets out how we're proposing this activity will be phased in the coming months. And there also, I appreciate some folk are more visual, there's a sort of plan set out in Appendix 1 of the activity over the year. I'll just highlight some of the key activities and when, importantly, the IGB would expect updates on them, just based on the different sort of groups of savings that were agreed by members. So for those savings that were agreed that could be implemented without further design work and completed by March 25, we'll bring an update to the meeting of the IGB on the 21st of March to confirm the position with those. For the other savings that the IGB agreed could be taken forward by the HSCP through our internal operational governance, but still require further design work, and that would be with our staff side trade unions and our professional leads. We'll do that work with revised service models. We would aim to have agreed by between June and September, and we'd then bring an update on that to the September meeting. And this will allow, as I've mentioned, around alignment with financial assumptions. This will allow the implementation of part year savings to be delivered in 25-26 in line with what the IGB have agreed. In relation to the next group of savings, which were the ones that required further development. So these were ideas that the members agreed that we could further develop into impact assessments and engage on. These will be brought back in September, and this would be following work to carry out the integrated impact assessments with groups of key stakeholders, and then carry out a period of engagement before bringing it back to the IJB. And then also in line with the recommendations agreed in December, we will move forward also to assess any requirement and impact of moving to eligibility, critical only eligibility for new packages of care. But as this is an ongoing review, we've not got a date to submit proposals for the IGB's consideration. So this will be more something that we'll monitor and bring back as appropriate and necessary. Also, just to pick up on the recommendation around the use of Renfrewshire Council's voluntary redundancy and voluntary early redundancy policy. Discussions have progressed with the Council's HR team, and we are suggesting that we send a letter to those that are applicable so that they can register interest, and this would allow us to gauge the level of interest among staff. So if approved, that we'd suggest that this outcome would be assessed as part of the wider programme activity and brought back to the IJB for consideration. And then finally, it will be necessary, as members are aware, for the IJB to consider additional saving ideas and proposals to address the continued projected financial gap in later years. So the plan would be that the HSCP will continue the process of identifying further savings and bring these back alongside the more developed proposals that we're working on to the September IJB meeting. So there's quite a lot in the paper. It's quite a brief update, but we're more than happy to take any questions. Thanks.
Okay, thanks for that, Frances. Lisa Marie.
Thanks, Chair. It's a comment rather than a question, but I just wanted to say that I think that the kind of timescaling seems really sensible and appropriate to me. I know early in the year we maybe would have been talking about doing some of this stuff for March, which felt unrealistic, I have to say. I think this feels much more realistic. I appreciate both the detail and the kind of table. I think it very visually shows where we are, and it will also help the people who use our services to understand when we're going to do things. We've moved on from a position where we really make all of these decisions in March to a position where we're looking at things across the piece every year, and I think that's true of the whole of the public sector. It is a power of work that you have to do, and I don't think any of us want to do any of much of this, but I am pleased that you've given yourself enough time to do the work. I think the pressures are enormous, and I can understand if that made us want to do things quickly, but I think giving yourself time to do it and feel that you've done things properly and engaged properly with people is the right thing to do. So I was pleased to kind of see the spread of the work.
Yeah, I agree with that. Thanks, Lisa. Ian.
Thank you. I suppose from my point of view, you know, this decision was made late last year, and we're getting on with the job, I suppose, of implementing that decision. And, you know, I would just want to be reassured that people affected by these decisions are kept in the loop. They know what's happening. I wouldn't say it's quite on a daily basis, but it's on a regular basis. I get people contacting me about some of the decisions, how it's going to affect them, and you out in the streets in the supermarkets, as well as your traditional emails and stuff like that. People are speaking about it, and you know, people are really concerned. So I suppose I would just seek that reassurance that, you know, these issues are handled sensitively. Communications are kept going, and we involve not only service users but trade unions and staff members as well. Thank you.
Okay. Thanks for that. Mark. I'm sorry, Mark, I can't hear you. Still can't hear you.
Can you hear me?
Yes, I can hear you now, Mark.
Sorry, my signal keeps going, so apologies.
Oh, no.
I just want to come in 3.4 and the second bullet point related to sickness. And I think it would be, if we're going into a period of change, that consideration is given to the reasons for absence.
Yeah.
And we need to ensure that any cuts to services or change or focus to services that doesn't impact on that level of sickness any further. Because obviously there'll be added pressure on staff and on delivering services, and it may bring them into some conflict. So I think that it'd be interesting to know what those reasons are, that we're not going to make that situation worse going forward.
Yep, absolutely. That's a good question, Mark. Okay. Right. If there's no other questions or comments, can we agree to note items 5? And that takes us on to item 6, which is the refresh of the IGB strategic plan. So is that getting yourself, Francis?
David's going to present this so that you don't have to have the next 3 papers presented. So I'll come back in for the performance paper. So I'll hand over to David for this. Thanks.
Yeah, thanks, Francis, and thanks, Jennifer. So members will recall that back in June last year, the IGB agreed that officers would work to review and refresh the IGB's existing plan for a further 2 years. So that decision is really reflective of the view that the themes within the plan remain relevant, and also that the HSCP, as we've mentioned in relation to other papers, has limited capacity due to the breadth and depth of the Sustainable Futures programme, but also responding to a range of inspection activity and delivering on wider service development priorities. And there also continues to be a lot of wider uncertainty in the policy and funding environment, which we've touched on, most notably in relation to the National Care Service, and that was something that Christine had covered earlier in this meeting in terms of the announcement that was made in Parliament yesterday on the way forward for the National Care Service bill. So following the meeting back in June, we've undertaken a range of work to review the existing objectives within the plan, and we've also updated and tested those through workshops with members of the Strategic Planning Group. And that's resulted in a number of changes being made to the plan, which I think were more significant than we'd really originally envisaged. Those changes include an increased focus on the financial context and the challenges facing the IGB. And we've also really done a lot of work around extending the use of data and projections from the recent census and also the health and wellbeing survey to improve the level of detail that's in the context of the strategic plan. One of the key changes that we've also made is to merge the healthier and connected futures themes. So that reflects that there's an identified overlap between the intended outcomes for those within the current plan, and we felt with SPG members that they would be better combined with one another. And we've also reduced the number of objectives overall within the plan to a more achievable number of 21. So that's been significantly reduced. And we've also defined the objectives in a way which we feel gives us more flexibility over the next 2 years, taking into account those challenges around resources and the kind of uncertain policy context that we're working within. And we've also looked to align the objectives with more than one theme where appropriate. So one of the key discussions we had with the SPG was that it was felt that a number of the objectives actually could allow us to deliver the outcomes within more than one theme. So it made sense, and it is more effective for us to align them with a number of themes where that's required. And we've also introduced 7 key principles within the plan to reflect additional feedback from the SPG, that those principles were really kind of underpinning all the themes and objectives that we've identified. So they really sit underneath everything that we're going to try to achieve. I would also note that the housing contribution statement within the plan has been significantly streamlined to focus on 3 key priorities. And we now feel that the statement itself is more clearly identifiable within the plan, and we'll be able to report on that more clearly moving forward. And in terms of the wider changes, just to reflect all of those changes that we've made have been reflected within the plan on the page as well, which has also been updated. So in terms of next steps, Section 6 and Appendix 2 of the paper set out the proposed plan for consulting with prescribed consultees on the draft strategic plan. This approach also reflects that the consultation we undertook on the original plan is still highly relevant and informs our thinking moving forward. The consultation itself we're scheduling to carry out during March and April, with the aim that it's separate from the timings for engagement that are set out in the Sustainable Futures paper. I think it's important to note that officers really recognise that developing and consulting on this refreshed plan within the context of the IGB's ongoing consideration of savings is really not where we'd want to be in an ideal world, but it's something that we need to do from a legislative perspective. So as such, we'll look to reflect that context in the plan communications that we send out around the strategic plan consultation itself. So should members approve the recommendations in the paper today, we'll look to bring back a final draft of the plan for consideration in June this year. Very happy to take any questions.
Okay, thanks for that, David. Right, Councillor Cameron, Jacqueline.
Thanks, Jennifer. Yeah, it was a great document, David. Thanks for that. Not just in terms of the strategic direction, but I think it was a really good reminder of all the positive work that is happening. I think when we are facing the, the kind of financial constraints that we are, it's only human nature to focus on the negatives. But when you see a document like this, you just get a flavour and a picture of everything that's going on and all the hard work that's been undertaken. And I just wanted to pick out a very small point about the Fairer Renfrewshire Lived Experience panel. I know that you've commissioned a piece of work for them, and they're absolutely loving it and really enjoying being part of this. So that's great. I also thought the bit about housing was really good. It's so important that people do live in safe, warm homes, and a day like today, it's more relevant than ever. But I think it shows again how the HSCP and the council work together, and I think sometimes we don't always see that, but that this document makes it clear how we're all working together. So thank you for that.
Thank you.
Okay, and Ian, see you next.
Thanks again. Yeah, I thought this was a quite an easy read. As councillors like things that are quite simple and easy to understand. So it was quite a good read. I don't really have a huge amount to say it, but I suppose I'm just really backing up what Jacqueline Cameron has said about the importance of housing. You know, I think is speaking in. Not trying to speak on behalf of the other three councillors in the meeting, but our caseload is still traditionally inundated with housing. And if you don't have a decent house, if you don't have a house that's the right size for you and your family, the impact that can have on your particularly your mental health can be quite severe. The number of cases I'm dealing with at the moment, particularly younger women with children, is quite high. It's higher than it's been for a number of years. So I think in page 98, and it talks about a healthy home leads to, and it gives a whole load of bullet points. That's spot on. Totally agree with that. So no, thanks very much for this report. Thank you.
And yourself, Kathy.
Thanks, Chair. Yeah, just really to echo the positive comments that have been made already. As a new member of the IGB, I wasn't here in June when it was originally proposed, so it was a good way for me to get under the bonnet of the strategic direction of the IGB. And I absolutely welcome what you're saying, David, about the reduction in the number of strategic objectives and the dovetailing to the common outcomes. That makes complete sense. And the point that you're making in 4.2 to support the targeting of constrained resources towards key priorities. And your point, Ian, there, where you're giving, a tangible example of what that actually means for families in Renfrewshire makes complete sense. So just to say thank you and look forward to what's going to emerge from this in relation to the dovetailing with the financial constraints. Thank you.
Thanks for that, Kath. And I'd just like to say, David, Lisa Marie has put in the chat box some a bit of issue with her internet, but she was just also wanting to say that she wanted it noted both the readability of the document and the really strong use of the data to influence the plan. So just so you knew that. Okay then, so if there's no more questions or comments, can we agree to note the report? And that takes us on to item 7, which is the performance management mid-year report. And that's back to yourself, Francis, is it?
Yeah, thank you. So this paper updates members on mid-year performance for April to September 24, and there's a full update to the scorecard attached within the appendix to show the progress since the end of the 23-24. I just want to flag that we have picked up an error in the report with one indicator, and it relates to the number of new adult carers reported by Renfrewshire Carer Centre. The positive news is that this is actually now a green status instead of red, so it's on track to be above the target set. So whilst an error, it is bringing better news. So the 288 figure that was put in the report was actually only the Q1 numbers. And at mid-year, it's actually sitting at 495 carer supported. Right. So that's positive. So reflecting that change on the overall position of our scorecard indicates better than reported, with a 15% reduction on the red status indicators from 23-24 year-end position, and an increase of green status indicators by 13%. So whilst this is positive, there is a few things to note. Only 29 of the 50 indicators have targets against them, and that relates to the revised and improved scorecard that we developed, and we're still getting trend analysis and baseline for a number of those areas. And also, as always, we just need to exercise caution at this stage, because as we're acutely aware today that the winter period can bring new pressures that can exacerbate and impact performance. And then also we're also operating within the wider financial and resource pressures, which we've talked about today, which we reference within the Sustainable Futures approach that we are trying to balance those demands and maintain a good performance, but it is just to highlight that it is exceptionally challenging. So I don't plan to go into the performance results in detail, but the report is really sort of split in two main sections. The first focuses on the indicators where we've got targets in the RAG status of those, and we summarise, then in the second part, some of the improvement work in the position for indicators that don't have targets. So in relation to the ones that do have targets, the things that I would just highlight is the improvements where we've now got moved to a green status, and that's for emergency admissions from care homes, breastfeeding in deprived areas, the percentage of foot ulcers seen within 2 working days, and the rate of pregnancies under 16 years of age per 1,000 women. We've also got 2 indicators that have moved from red to amber, relating to staff PDPs and low birth baby rates. And then we felt it was important to highlight where we're sustaining performance, because as members are aware, sustaining good performance can be still exceptionally challenging for our workforce. And then finally, and importantly, the areas of improvement, and we've tried to provide some detail and assurance of the work that's going on to address those areas and improve them. And that relates to any weights, sickness absence across both health and social care staff, which continues to be a real focus for the SMT, adult support, carer support plans, and smoking cessation. In relation to the indicators that don't have targets, we've touched on a number of these already, but we've picked up on the continuing challenges around prescribing. And in relation to that, Sarah has outlined some of the external factors that are impacting that too. There's an update on scheduled care. The paper incorrectly references a specific, more detailed unscheduled care paper that was planned to be on the agenda for today, but it was actually delayed, so it will come to a future meeting. But in relation to delayed discharge, we obviously highlight our strong performance for delayed discharge, but and a slight decrease in A&E attendances. But we continue to monitor that. And then we've provided some narrative around some of the really important adult social care performance indicators around how we're doing and some of the improvement work there. And we'll be hoping to be able to start to provide in sort of baselines and targets for them going forward. And then we've just highlighted some at the end, some of the next steps around the improvement work that we're looking to do in relation to our performance framework. And I think one of the big areas is about how we align this to some of the decisions that will be taken through the Sustainable Futures programme and the impact of that. That is quite challenging. But it's something that we recognise that if we can get more robust performance information, it can assist with decision making, how best to target, prioritise resources, but as I said, understand the impact of changes such as service redesign. So that is something that will be a focus for our new performance manager and myself in the coming months, and we'll bring a full scorecard as part of the annual performance report, as always, in June. So if there's any specific questions relating to the services, the heads of service are here to answer, and I'm happy to take anything around the general approach to performance management. Thanks.
Okay, thanks for that, Frances. Ian, I see your hands up first.
Thanks very much, Chair. Just kind of three things I would kind of like to highlight, and I've mentioned this before, and about sickness rates, and going back to what Mark had been mentioning earlier on, at a time of flux and a time of change and a time of pressure, a time of uncertainty, sickness rates tend to go up. So, I've read the improving work underneath it. Just need to obviously keep on top of this particular situation, and I know there are things in place, and I'm sure the trade unions will be working with their members as well. The carers over the page, on page 121, that seems to have decreased slightly. So I suppose I would just urge people who are involved in that side of the business, if you like, to keep on top of this. There is certainly a line in it about supporting ethnic minority carers, and I know the Carer Centre are doing some good work on that as well. The last thing is at 6.3, smoking cessation. I was interested to see about the education that's going on, or the education session, training sessions that are going on for staff about vaping, not only smoking, the traditional smoking, but the vaping as well. And I think we all know the number of young people who are taking that up. We just need to go drive by or walk by our schools, and we can see what's going on. We just see it all lying about the pavement. But of course, it's not just children, it's adults that are taking up vaping as well. People that I've never known to smoking ever are now starting to vape. And I'm not entirely sure why. I just can't get my head around it, why people in their 40s and 50s would suddenly start wanting to vape. I just don't get it. But I'm glad to see there's a lot of work going on that field. Thank you.
Okay, thanks for that, Ian. Jacqueline.
Thanks. Yeah, I was going to reflect on the section about the carers as well. I'm glad it was a typo, Frances, because I was going to ask about that. Obviously, we were all at the Carer Centre last week, and I've never seen so many politicians in the one room. So we're certainly there to support them, and there's a lot going on with the carers discount card as well that was launched recently. So I'm glad that was a typo.
Okay, and Paul.
Can I pick up on an early discussion about hospital at home? Is it going to be reported as performance management in the future? Though I'm not sure there's a specific target to measure it against.
I can pick that up if you want, Chair. Yeah, in terms of the measure, we don't actually have a measure to set aside, but we absolutely will be reporting on the performance around hospital at home, and we'll do it through a couple of measures. We might want to do it through unscheduled care, and we'll also pick it up through the Chief Officer report, so that we'll be keeping everyone alert to what's happening. I think once we're up and running, we may then start to set performance targets, but at the moment, whilst we're taking it really slowly, slowly and doing tests of change around one patient at a time, it probably wouldn't be beneficial to have any targets in place.
Thank you.
Thank you, Bob. And Kathy.
Thanks, Chair. Yeah, just to pick up on the sickness absence rate, I just wondered, is there the opportunity to have a shared metric on that? Because adult social work, it's by whole days, and NHS it's percentage. So that's just I noticed that again as a new person. I don't know how long I can get away with saying I'm new. I think I've tipped into into that. And then also just to commend the health improvement team for the red to green on the exclusive breastfeeding and for young women in deprived areas. I think that's fantastic work. And it's excellent to see that. Thank you.
Thank you for that contribution, Kath. Frances.
Yeah, I can just pick up on the sickness absence. We would love to have a sort of integrated measure and view, but unfortunately that's out with our control, and we've not been able to get an agreement with the council around a percentage. It doesn't seem as straightforward as just converting the days into a percentage. So it is something that we've been in discussion with them for a long time. So yeah, it's definitely the council are aware that we'd like to move towards this, but at the moment it's still outstanding. So.
Oops. Right, thanks for that, Frances. Okay, so any other questions or comments? I don't see any more on my screen. Okay, can we agree the recommendations on page 115? And move on to our last item of the morning, and that is the date of the next meeting, which will be the 21st of March at 10 AM in Renfrewshire Council. And I'm just away out to put down my willy bins. Honest to God, back down the hatches. Oh, sorry, I see Councillor Cameron's hands up. Jacqueline.
I just wanted to check that this is Christine's last IJB, yeah.
Yes, I'm actually well done, Jacqueline. It is, I think. So
okay.
Yes.
So can I say my wee spiel?
You sure can.
Thank you very much. No, I just wanted to say that I think I can't remember when Christine came along, and I just think was it 2018, Christine? But anyway, just wanted to say wish you the best of luck in Edinburgh, and you've been a brilliant chief officer. I was involved in your recruitment, and I always knew that you were going to shine, but I didn't think that you'd be snapped up by another IJB. But as you said, Jennifer, Edinburgh's gain. Sorry, our loss is Edinburgh's gain. So good luck. I don't even know if Christine's. I can't see her on the screen, but anyway, just to say all the best and thank you for all the hard work that you've put in, and most of all, I think it was just lovely to have a chief officer that gets people, and you know, you might think that that's common, but it's not always common, and I think that's just something that's been brilliant for Renfrewshire. So thank you so much, and I'm sure the team are going to miss you too.
Thank you, Jacqueline. Ian McMillan, I see you're next.
Yeah, just to say a few words about Christine. As you know, I was a former chair of the IJB, and when I stopped being a councillor, I just I kept my interest. I'm saying, oh, who's this woman? It's just been appointed. Little did I know, a few years later on, I would be working with the IJB and working with yourself, Christine. No, listen, just thanks for everything for the last 2.5 years whilst I've been a member of IJB. I sometimes find it a bit difficult being an opposition member on the IJB, and you've always been very, very helpful. You and all the senior teams have been really, really good and really, really helpful. And I know we've had several meetings, just you and I, with the other senior members of staff, and you've always been very candid, straightforward, and honest, and very helpful. Just remind you, we've still got one piece of unfinished business. I'll not speak about that now, but we're still to get something to do before you head along the M8 to Edinburgh. But listen, best of luck in Edinburgh. I know Edinburgh's it's no any different from any other IJB. It's got its issues, but Renfrewshire's loss is definitely the capital's gain. So best of luck.
Okay, thanks for that, Ian. And yourself, Max.
Yeah, and I guess it's just to add to what everyone's saying, not just through the IJB, but Christine, you've really contributed to all the aspects of my health board and IGB role, and it's been really great to work with you. You're not finished yet, because I know you've still got a number of commitments over the next wee while, so I will see you over the next few weeks through February, but thank you very much for everything you've done and supporting me through the various roles I've had here at the IGB as well. So best of luck. And you can change your mind. I'll just say that formally. I think you could at this point still change your mind, but understand that you want new personal challenges. So good luck. Thanks, Christine.
I would just echo the sentiments, Christine, of what's been said here. You know, you're relatable, you know, and that's the most important thing. You're approachable, and you know, you don't feel daft coming to you and asking you questions, and you know, out with the meeting, you really are. You're supportive. You're a great loss to us, but as I say, it's Edinburgh's gain, and I would like you to change your mind, but I don't think there's much chance of that. So, oh, hang on, Mark would like to say something. Come on in, Mark.
So, sorry, Councillor, at a much more mundane level, and it's not a valedictory for Christine, which I'm sure she'll get from the CMT later. Can I just ask that if any member has not returned your register of interest update, can you please get back to me and Jeanette? Thank you.
Okay. Right.
So
Christine.
just to say a couple of words as well. You're trying to make me cry, I know you are. Thanks very much for the kind words. It is a bit bittersweet I'm going to cry, moving from Renfrewshire, but I'm looking forward to the challenge in Edinburgh.
All the best. You'll be a miss, Christine. But keep in touch. Let us know how you're doing, and we'll be following your progress with delayed discharge. Right. Any other hands up? No, I'm not missing anybody, am I? Because we've got 3 screens here.
Jennifer,
Right.
sorry, I've
Yes.
got my hand up.
Right,
It
Jacqueline,
was just to
come on in.
say that I missed the first item about the membership because I dropped out. So I don't know what happened.
You were appointed to the audit risk board, okay?
While I was away.
You were picked on because you weren't there, Councillor Cameron.
Audit risk and scrutiny board.
Right, okay. Right, thank you.
Okay. All right. Right, okay. That just leaves me to thank you all for your attendance today, and good luck with this stormy weather. So all the best, take care, and I'll see you soon. Bye-bye.
Thanks,
Thanks.
Thank
you. Bye-bye. Thanks, bye.